Okay, in this second part of the introduction of and really talking about the major issues, I'm going to start discussing the evidence for those different possible definitions that we went through at the very end of the first part. So our first piece of evidence comes from people with blind sight, and this is evidence for that definition that came from Neil Carlson of consciousness being something that we are aware of and can communicate with others. And you might even decide, what does it mean to communicate with others throughout all of this. So the evidence from people with blind sight. Blind sight describes what people have when they have damage to their visual cortex. Okay, this is damage to the back of the brain, the cerebral cortex, that primary visual receiving area. This happens usually from stroke, or it can happen from head injury, but there are lots of blood vessels that go up into that back part of the brain, and so strokes are relatively likely to influence the visual cortex. But it's also, so it's at the very back of the brain, and if we get hit at the back of the head, we might have some damage to the visual cortex. What happens is we have damage to, when there's damage to the visual cortex, we are not seeing in the part of the field of vision that falls in the damaged areas, or they deny seeing the objects that are falling in those damaged areas, but they can interact with the objects. So I'm going to do a little bit, and I'm going to come back to this when we talk about lateralization and how the brain receives information. But if I'm looking straight forward, so you might pick, I have a Pioneer on my speakers and it's right in front of me. You might pick a place in front of you to fixate on and put your right finger up sort of in the center of your field of vision, but then move it over to the right. Okay, so it's right in the kind of center from up and down, but it's over to your right. That is falling right now on your left, in your left visual cortex. And so you can actually take your left finger and point to the back of your brain, just kind of in the center at the back. If you move your right finger down, okay, you want to move your left finger up. And that is where, so down and to your right is hitting at the visual cortex, the back of the brain, up and to the left. And if you move your right finger up to the top, again, it's still over on your right-hand side, you move your left finger down on the down into the left on the visual cortex. Okay, so I'm going to go ahead and tell a vignette that describes some of this. So Natalie brings her grandfather in to see the neurologist, and the neurologist is going to do some try some things to see what her grandfather's actually seeing, and to show them what her grandfather is actually seeing. He has damage to his visual cortex, and he's saying that he can only see a really small, so if you look again, if you pick your fixation point, so my little Pioneer, that word on my speaker, he's really just seeing that. Okay, and everything outside of that is damaged, and he can't see that any longer, or he denies seeing that. The doctor takes the man's cane from Natalie and asks the man to look straight ahead and point to the cane. And the guy says, "I can't see it. That's what I'm telling you, is that I can't see the cane. So how can I point to it?" And the doctor says, "Well, just guess where the cane is." And the guy says, "Okay." And he points, and he actually hits the cane with his finger as he's pointing. So he points right to it. Then the doctor takes the cane and he kind of points the handle at the man, and he says, "Grab the cane." And the guy's again, "I can't see the cane." He's like, "Well, just guess at, if you were going to guess at where the cane is, and grab it. And the man moves his hand so that he grabs the cane appropriately. The doctor spins the cane around so that the handle's pointing towards him, towards the doctor, and or actually let's do it like kind of halfway around, and asks the man to grab the cane, and the man again kind of spins his hand the right way in order to grab the cane appropriately. So the argument is that he's not aware of the object, but he is able to interact with the object. And what's going on here, I think this picture comes from Carlson, and I don't love it completely because I would like it to be information coming in through the eye, going through that primitive visual system, and then the mammalian visual system that's happening in kind of bluish there, that would come after actually the primitive visual system. Because what's going to happen is it comes in through the eye, it goes to those subcortical structures, so not in the cortex, but the subcortical structures. That is the primitive visual system, or sometimes called the reptilian visual system. This allows for eye and head movements, reaching for us, for people with hands, reaching movements with hands, really simple kinds of behaviors. Okay, the mammalian visual system is really when we get to the cerebral cortex, and this allows for more complicated or more complex behaviors, as well as for speech and thinking in words, or as Carlson is claiming, consciousness. And here I agree with him. I feel like these people are not conscious of the objects. They are denying seeing the objects, but they're able to interact. Even though they have damage to that mammalian system, to the back of their head, that information is still getting to the primitive visual system. It's still going to the subcortical structures, and actually some of that information comes from the superior colliculus up to the parietal region. So there is a little bit of higher level activity there, but it's just not going through the visual cortex, which means we're not getting the higher level processing that's coming from what we would be receiving at this first receiving area. Okay, so the argument is here, they're denying it, they're not able to communicate that they can see it, but so they're not conscious of it. And again, you need to decide what you think about that. So that's one example of evidence. The second piece of evidence comes from split brain patients. Okay, these are patients who have their corpus callosum severed, and what I'm showing in this picture is that corpus callosum is pointing to this band of fibers, so axons, that are allowing for communication between the left hemisphere and the right hemisphere of the cerebral cortex, which means those two hemispheres are operating pretty much independently. There is still some small amount of information being communicated via various commissures, as they're called, and especially so the subcortical structures are still communicating back and forth, but the cortex has lost the vast amount of communication that happens. So the left hemisphere, some people talk about them as having a split personality is not the appropriate way to talk about them, but that they are of two minds, because their left hemisphere will want certain things, their right hemisphere will want different things. Okay, so let me get into the lateralization of the brain and how the brain is receiving information, to discuss some of the behaviors of split brain patients. But so that corpus callosum is severed. Oh, I did not say. So this was used in the past, sometimes for cases of severe epilepsy. From what I understand, it is not used anymore. But I thought that taking the medial temporal lobes and the hippocampi out was not used anymore, and I do know a person whose son has had that procedure, so it might still be used a little bit, but I don't think so. So with epilepsy, what is happening in the brain is that there is overcommunication, and so neurons will start activating other neurons, and we see more and more activation, and that just spreads. Basically, that overactivation spreads across the brain. And so if they sever the corpus callosum, what this basically means is, if I'm having what would be an epileptic seizure, and it was starting in let's say my right hemisphere, then that's going to be contained in my right hemisphere, so that those severe seizures that people are having aren't happening in quite the same way, because it's not being communicated to the other hemisphere of the brain. Okay, and to get into this part of defining consciousness, I'm going to pull out here and first talk about the left and right hemispheres. The hemispheres of the brain are not symmetrical in the sense that they are processing the same information in the same way. We have a lateralization of function, as it's called, which I'm going to go through on the next slide. But I'm first going to talk about how information gets into the brain. So we have what's called contralaterality, or contralateral communication, for our visual information, for our movement, and for our somatosensory information, where somatosensory is the feeling of the body, the sensory of the soma of the body. Soma is Greek for body. I'm going to do that a few times, just so you know that over the first few classes. So I'm going to start with vision, which is the more complicated to discuss, because what's happening in the right visual field is going to the left hemisphere. And I started going through this a little bit with blind sight, right? So if it's in the right visual field, that information, because of the way light comes into the eyes and is being reflected from objects, comes to the eyes. The right visual field, that information, if I'm looking straight forward, is hitting the left sides of each of my two retinas. And those left sides of the retinas are communicating to the left hemisphere of the brain. If information is coming from the left visual field, that is going to the right side of both of my retinas. And so both right sides of the retinas are sending information to the right side of the brain. And I'm just, what's being shown in the picture there is just the, how that information is hitting, and that, so let's take my left eye. My left eye is going to send its left side of the retina that's closest to my ear straight back, but its right side needs to cross over, and so it's going to cross over at that optic chiasm. And I'm going to go back through this again when we talk about sensation and perception, but it goes to the right hemisphere, the right sides of each retina. Okay, and vice versa for the right eye, how it's sending information. Somatosensory and movement are more straightforward in a lot of ways. I mean, they're complicated in their own ways, but I ignore the complications for this class. So if I'm touching something with my left hand, and you might do this, you might go touch something with your left hand, and if you point up to sort of the very top of your head, if we get to the parietal lobes, and you go to the very top of the head in the very center of the top, and then move off to the right. If you're touching something with your left hand, that is hitting there at the top right hemisphere. So it's contralateral, speaking to the other side of the brain. Same with the movement. So when I go and take my left hand and wave it at people, that is, if you move your finger just a little bit forward, again, it's kind of all central, but you're moving forward in the brain, central in one direction, but forward in the brain, then that's the movement of the left hand, and vice versa. So if I'm doing things with my right hand, that's utilizing the left hemisphere. For olfaction, for smell, and for taste, we have ipsilateral communication, which means it's going to the same side of the brain. So if I'm smelling something with my right nostril, that's the right hemisphere that's going to get that information first. The right side of my tongue and cheeks and so forth, where I'm tasting, that's going to the right hemisphere. Hearing is a bit more complicated. For the most part, it's contralateral, but there is some ipsilateral communication. So if you ever read, it's Sperry and Gazzaniga and those people who are looking at split brain patients, they don't use a lot of, they don't have the examples in the research where they use what's happening with hearing, because hearing is a bit more complicated. Okay, so that was the contralaterality and ipsilateral communication, which ipsilaterality is a word, I suppose, of how the brain receives information. Now I'm going to go into that lateralization of function, that the hemispheres are not doing the same thing, that we have this kind of lateralization. And generally, these are very big generalizations in my mind that are overstated, but I still think they're interesting, and we might, and I'm gonna treat them with the generalizations that most people do, but they're still overstated. And it's really different for people with their left hands who write or who are left-handed, and it can be pretty different for people with dyslexia and other things. So it's not, they are generalizations, just so you know. The left hemisphere tends to be more analytic. So it is helping us with grammar or the pattern recognition as related to language. We put the language for humans, language is happening in the left hemisphere, but it's also analytic, and we might think of it as looking at the trees as opposed to seeing the forest. We see the trees and the pieces and the parts. The right hemisphere, again, overgeneralized, but I'm going to do it. A synthetic, holistic kind of perception. So now we're seeing the forest and missing the trees and the pieces and parts. We have here really visual conceptualization is how I think of it, but face recognition happens here, pattern perception, visualization, those kind of visualized concepts, if you will. We also interpret emotional expressions. That kind of interpretation is happening more in the right hemisphere than the left hemisphere. So I have up this picture, and I'm going to ask at the bottom, and I'm going to ask you what you see. Just briefly, you can tell me. You can tell yourself here, I guess, in front of a computer what you see. Okay, and I usually get, so what's interesting is usually a couple people call out, but last semester was really interesting because I did this in the Monday class and I took a poll, and I can't remember what the percentages were now, but so some people see the S's first, especially what do you see first? What do you first notice? And some people see the L first. And last semester it was funny because somebody was saying it took me a long time to see the L. I didn't know what people were talking about with the L, but you see the S's make up an L. Some people see that L first. Some people see the S's first. And if you see the S's first, you might think of yourself as more left brain than right, using your left hemisphere more strongly. Again, I feel like that's really overstated, but it's still kind of a cool demonstration for classes. And if you saw the L first, you might think of yourself as being more right-brained or more the right hemisphere as being a stronger player in it all. But they communicate very quickly across the corpus callosum, and I still think those are overgeneralizations. And again, might not even apply to you at all if you're left-handed, you're dyslexic, or if you're just a different person, which does happen. Okay, so I'm going to come back to this. The fact that we are defining consciousness and what's going on in the left and right hemispheres, and what's going on with these people who are split brain patients who have had this split brain surgery where their corpus callosum has been severed or cut. And in this particular example, what they've had is the person is smelling the perfume with the aroma of rose with their right nostril, and their left nostril has been plugged. And remember, so now that's going to the right hemisphere of the brain. There's not really the communication because of the surgery to the left hemisphere. The left hemisphere is not experiencing this. So the person is denying that they are smelling anything because the speech is really on the left side. And as we are explaining things in our head or to people, that is happening through this verbal language, the left hemisphere, it really needs the information from the right hemisphere for us to experience the world in such a way that we're going to say, this is what I am experiencing. I hope that made sense. However, so remember that the right hemisphere is controlling the left hand. And so if they have this person choose from a bunch of objects, what object would they want to choose? They would choose the rose, okay, and hold that up. Now, if we ask the person, why did you choose a rose? They're going to make up some story that has nothing to do with the fact that they smelled this aroma, because the left hemisphere is not experiencing this aroma. So what does this mean for defining consciousness? Well, according to Neil Carlson, we're not aware of smelling the perfume at all because we are not communicating it with other people. But this is where I disagree with Carlson, because I feel like they are communicating this in some way. They are picking out a rose. And I'm going to just give a couple of examples of some of the behaviors of people who have split brain, who've had the split brain surgery. One is they ask one of the patients, I think they did this with a few patients, but the one I remember is, if you could be anything in the world, what would you be? And he says out of his mouth, so the left hemisphere is saying, I would be an architect. Okay, I don't know why, but this is what the person wants to be. This is what's in his head as a neat vocation. With his left hand, okay, being controlled by the right hemisphere, he's at the same time, he's writing out race car driver. So his right hemisphere wants to be a race car driver. So they are of two minds in some ways. But to me, that communication of writing it out with the left hand, that is communication. And that feels like one hemisphere is not aware or conscious of what the other hemisphere is aware or conscious of, but it does not feel to me like just because my right hemisphere is the one that's conscious and aware, and my left hemisphere is the one that controls speech, that's what I'm the only thing I'm conscious of. So this is for me a really complicated piece of evidence that I don't agree with Carlson. They also have this experience sometimes of being in the grocery store and picking up something with their left hand and putting it back with their right hand, or reading a book, holding it with their left hand, but the right hemisphere is bored, it's controlling the left hand, and so they put the book down because they don't want to, the right hemisphere doesn't want to read it. So they are kind of two minds, and what we want to say about their consciousness, you can decide what you want to say about what that means as far as consciousness is concerned. And finally, and I can see that I'm going to have to stop today's lectures at the end of, which I think I often do, of Neil Carlson's definition, which again, something that we are aware of and can communicate with others, but you want to think about how much you agree with that. I'm going to end it with his third piece of evidence that he uses, which is spatial neglect. And I apologize, I go back and forth, and sometimes this is called hemi-neglect, and sometimes this is called unilateral neglect. And I go back and forth between the three, and I often can't remember what I used in my slides. So they're all kind of here. And you can see that the top there is a link. That is, I'm going to have it be required that you go watch that. It's really short, and it's really kind of interesting. And oftentimes I have students really react to it. So spatial neglect is what people have damage to the right parietal cortex, and it causes a difficulty in paying attention to the left side. Okay, so you can see this example of this person with spatial neglect who has left off the left side of the flower, at least the petals of the flower. We could watch them. They have, I think in your book, some pictures of clocks where they either draw the 1 through 6 on the clock and leave off the 7 through 12, or the 7 through 11, and then we go 12 through 6, or they have 12 through 4, and then 5, 6, 7, 8, 9, 10, 11, 12 are all kind of smooshed over there on the right side. So they're still putting it all on the right side, but at least they know I want to go all the way to 12. They tend to ignore the left sides of objects, the left side of space, and the left side of their body. So they might shave on the right or put their makeup on the right, but not the left side. They're going to brush their teeth on the right, not the left side. The left side of space, there is this example of people going to this kind of northern part and looking down on this area. I remember it was in Italy, but I can't remember the area, where they draw the west side, but not the east. And then they have them imagine themselves going to the right side, or I'm sorry, to the south, and drawing the courtyard or whatever it is, and they draw from the south, they draw the east, so what's on their right, but not the west, so what's on their left. How much they ignore, how much they tend to ignore all of these different things, it really depends on the area of damage and the severity of damage. And it's really specific to attention. And I say not necessarily perception itself, even though, like I said, perception is really influenced by attention, but it's attention It's not that it's affecting perception specifically. It's affecting attention, which is affecting perception. So I'm going to give another vignette from Carlson, where they go in to see a woman who has had a stroke and has unilateral neglect, and they ask, so the residents are standing around her bed, and the guy asks her, so you see some people in the room? She says, yes, hello, there are some people visiting. And they ask her how many, and she says, it looks like there are 6 people. And some of the residents on her left side say, well, what about us over here? And she says, I see you over there, but she's looking kind of straight forward. I see you over there, because she kind of heard that coming over from the left, but she's still, and they put their hand in front of her face and kind of draw her attention over to them, and again say, what about us over here? And now she says, oh, there are more of you. So once you get the attention, you work to get the attention to that side, they can perceive what's over there. It's really about attention, but they're not going to pay attention unless you're giving them several cues, touching them, making sound, and giving them visual cues, all of that. Otherwise, they're not going to pay attention. Okay, do go, and I have run out of time, so watch the dog at the beginning of the next of Friday's lectures, which is watch this link of the spatial neglect.